All right, well, let's get going. And thanks everyone for being with us tonight. It's a exciting topic we're talking tonight. And with us is Lori Most, and she is the founder and CEO and chief marketing officer and like chief all kinds of things to a organization called BackpackEMR. And instead of trying to tell her story, I'm going to let her tell her story. But the question I want to ask first, Lori, is we have a mix of people on the call tonight. We have some medical who, the initials EMR, they know exactly what it is and what it does. And I'm sure that group has a whole significant amount of EMR questions. And then we have a whole nother group of people on the call tonight that have no medical background at all, and they have no idea what EMR is or what it stands for. So could you kind of give us, for the non-medical people, just a 50,000 foot level of what we're talking about?
Sure. Yeah, no problem at all. Thanks for having me. I'm really excited to be here and meet all of you, first of all. And then just to give you the really brief rundown of EMR, especially since it's in the name here, electronic medical records is what EMR stands for. And I'm sure you've all experienced this when you've gone to the doctor. So it's essentially tracking patient health information just digitally rather than through patient charting on paper. And so we've kind of gone through that wave in the United States. I think it started, 10 or so years ago. There's a huge wave with federal funding that allowed a lot of us then to move over to EMRs. Now, if you're wondering why a lot of the medical people kind of shudder a little bit when you hear EMR, it's because in the US, they're very complicated. And it's because they really had to rush them in. So that is part of why EMR scares a lot of people. They're very complex. There's a lot of laws surrounding them. They were kind of rushed through. And so there's not a lot of user experience or really good design in them. And it's hard to redesign once you've gotten so far. So if you're on the non-medical side, that's why medical people get a little nervous about it. But I trust me, ours is different. So that's a quick rundown.
All right, awesome. All right, so sorry, I've got a thing in my throat. So if you could give us a little background on you and where you came from and how you got to where you are, and then specifically what was the driving force behind Backpack EMR. I mean, were you sitting under a tree and an apple fell and you had this divining moment, or how did this come to be?
Yeah. Okay. So my background is all software development. So I've been around the block here in the Twin Cities in Minnesota. And so worked for companies like Target, United Health Group, C.H. Robinson, a lot of the big companies here, the Fortune 500s. And I was kind of thinking, I started out coding, moved into design. I love design, making things easy for people to use, kind of translate into the technology. And so that's what I kind of spent the last 20 years doing previous. Then it was 2013 when I was at Target working on guest data authentication. This was after the guest data breach. So really trying to shore up that guest data. Just thinking I was kind of this little cog in this bigger juggernaut. So I wanted to do a little bit more for society. So I went on a medical mission trip with my sister. So she is a physician assistant. She does orthopedic surgery. She's a surgical PA. So I went with her to Peru. And so I was kind of watching the flow. I thought maybe I can help with some efficiency gains. I like that kind of thing. And so I watched the flow as they came in. So a lot of you have already experienced this, but there were, 100 patients waiting in line to get through the clinic in one day. So we had one day to get through everybody. We had 2 physicians, 2 surgeons, and it was trying to go fast, fast, fast. So they had these papers they were kind of shuffling around. They would take photos when they could of injury sites and faces. And at the end of the day, it took us until 1 o'clock in the morning to go through all of those shuffled papers to figure out who was going to get surgery, looking through all the different photos. Oh, is it on that device or that device? And how do we pair this up? And I thought there has to be a better way, right? And part of the problem too was past medical histories. There's all these different things that they were kind of missing with this paper process. So it was on the train. We were going to visit Machu Picchu. And I was like, just like you said, with the apple falling from the tree, it was like, oh my goodness, how can we do this better? And how are we going to do it? Because we don't have consistent internet and there's not necessarily electricity. So how are we even going to do this? How do you share data from my device to your device if I can't plug in a server into the wall? And so that was part of kind of this little brainstorming session I had on this train. But that's where BackpackEMR was really born. So we did kind of hunker down. I gathered a few other developers and we sort of brainstormed and came up with this offline data sharing network process. So there's no big server that you need to maintain. You don't need to plug it into the wall. There's like mini servers on all these little devices, and then they'll kind of all talk to each other. So that was kind of the breakthrough moment for BackpackEMR and what it is. So that's kind of how it all came to be, was through this Peruvian venture we had.
Awesome. Well, actually, I thought I had heard the story, but I hadn't heard that whole story. So that was interesting for me. So,
Nice.
all right. Well, can you share with us some of, I know you have this tool, your BackpackEMR is in the African continent, it's in the Caribbean, it's in Asia. Can you just kind of share, a couple of examples of where it's at and how organizations like ours are using it?
Yeah, definitely. So we did start out slow. Our very first group that really started using our primary care module was in Haiti. So it was in Ile La Vache, a little island underneath the island, is kind of where we got our start. So we do have multiple groups in Haiti. And then we do also, we've got 30 organizations using us right now across 24 countries. So we've got quite a bit of spread for where we are. We've got a pretty little group a good group in Haiti. We've got some in Uganda, Kenya. We're starting to work now in Rwanda, which will be a little bit of a bigger group for us. We're kind of all over. And really, we started getting our momentum from a lot of these US-based teams, just like yours, that are supporting local clinics, those sort of organizations, just like yours. We have one in particular in Haiti who has been using us for over 3 years now. It's probably been 3.5 now, and they have a long-running clinic. I think they have tracked now 35,000 patients. And so they've grown quite a bit since we started with them. And their whole plan was to start off with an EMR right from opening their clinic doors. And so that's, I think it's Admission Haiti, and they're still using us. They're pretty excited about it. Some of their feedback to us was their staff loves it, because it differentiates what they're doing. So they get excited about the fact that they get to use an EMR. So they think that's special. And then the patients themselves actually feel like, this clinic cares about their data. They're tracking it and storing it, in a medical record. And so the patients like to come there too. So that's kind of been the feedback we've gotten from Mission Haiti so far. But we kind of have a mix. We've got a lot of permanent clinics and then a lot of teams who do those medical outreaches. So they'll kind of come in and they'll do some outreaches in the villages. And then they can also monitor remotely. So we have the ability for them to kind of review patient charts while they're away. Then they can still see their patients from afar. So that's kind of the range of use cases we've got going on right now.
So can you talk a little bit about how one of the things that makes BackpackEMR so effective in the environment of like what FOTCOH works in? Just can you talk about the design or the simplicity of how it actually works a little bit deeper so people can understand that?
Yeah, it's a little bit crazy. When we first started this, back in 2015 is when we had our first prototype. This was definitely pioneering technology. And so we were trying to figure things out, and it's not like you could just Google how to do it or ask someone. So we had to try to figure out how we could do this. But essentially, you've got, I think I've got one around, you've got a device. So this one's a notepad, but you've got your iPad here, and on here will sit a little database. And so essentially I'm at registration, I'll type in my registration information, the initial patient information, and it will immediately push out all of that data to all of the other devices that are in the area. And so that happens through a little router. It's not connected to the internet. It's just connected locally. So it's just a little local Wi-Fi signal. And then as long as these devices are all connected to that, then I know that you should be able to get my data. And there's lots more security around that as far as which devices have access to which data and all of those kind of things. But if you're in reach, then I'll send my data to you. And then same with the others. So my registration information goes to the vital station, goes to the exam room, to the labs, to the pharmacy, and their data comes back to me as well. So we're all sharing data constantly all the time. So there's no single point of failure, which is one nice thing too. So if one iPad, if you drop it, or, if it gets lost or stolen or something happens to one iPad or two iPads, it doesn't matter. All the data is on all the other devices. So you're in the clear, you're always going to have all of your data. And then it does back up to the cloud. So if you are connected to the internet, one of the iPads, you can connect them and all the data will go up and will be stored and backed up in AWS. So it's got a few different modes. So you can use it completely offline. You can use it offline with your friends, with all the other devices, or you can use it online as well. So there's kind of those three different ways.
So, so a patient comes and we call it crowd control out in front of the gate. They get checked in. They come in through, I'm simplifying this. They come in through the gate, they go to triage, they see a nurse, they go through triage, and then they go and they see the provider, and they meet with the provider. Provider makes a prescription. They go to pharmacy, they get the prescription filled. And then if there's any other training or education in any of our other programs, and then out they go. And so each one of those steps along the way, they have an iPad or two or three, whatever the number is, so that every step of the way we track that patient through that system. Correct?
Yep, exactly.
Yep. And then I know the other thing that we've done, or one of the things that we've done to this, is that we have put into, we've been able to use some user defined categories to put in our, some of the typical things that we diagnose. So our dossier is kind of into that system, and our pharmacy, our what's the word?
Formulary.
Yes, thank you. Our formulary has already been plugged into it. So, when Roger in the pharmacy, when the provider, prescribes the medicine, it pops up on Roger's iPad and it's already in there. So all of that stuff has been preset in there, and it's not customized to us at all, but it's a little customized to us.
Yeah, absolutely. So we try to stay from a software perspective, and just to keep costs low and to keep the whole system simplified, we try to keep it pretty static and pretty simplified for everyone. But then we do have a few of those list of values that are customizable for everyone. And so you can put in your own diagnosis, you can put in your own treatments, your own list of formularies. So all that is customizable for you. And then we're soon going to have more customizable fields as well, so that you can make it a little bit more your own as well. But like you said, we try to keep it as static as possible. Again, that's the name of the game, right? We're all working in this area, in this humanitarian space. We want to keep costs as low as possible. So we do have it modularized too. So primary care is one. We've got cleft lip and palate surgical. We've got orthopedic surgeries. And then we're also adding in pediatrics as well. So we're going to bring in, we've got immunizations releasing next week, a patient summary, and then we're also going to get growth charts in there as well. So we'll have that extra pediatric module as well. It'll be just a little bit different. So you can kind of pick and choose as you go. So you don't have to have, I know for the medical people on here, an EMR is so complex that you want to keep it as simple as possible, if we can. And so the module just shows what you need for that visit. So that's what we're trying to accomplish with the modules. So that primary care module isn't showing you all the surgical stuff, or you don't have to look and click around. It's exactly what you need. So that's the idea of those modules.
Can you talk a little bit about, I just had a question pop in, and I've had this question as I've talked about EMR for the last the year that we've been getting ready. How have other organizations handled the background dossiers, the background data on patients? We have thousands of dossiers on patients going back multiple years. how do we handle that?
Yeah, so we have had some groups who have gotten their interns or volunteers to hand key some of those in. So that's how a lot of teams have handled that in the past. Otherwise, you could keep those in the rotation. So, it's a little bit more work. If you want to pull their dossier along with then keying things in that's new, that's a little tougher. But if you've got interns or volunteers who are excited about data entry, that's a good job for them.
Yeah, we'll have to figure out how we get them down there, but yeah, and I think, one of the things we had talked about was, as we see, as a patient comes in, if they have a dossier, then, we make a determination whether we're going to input that background or not. And then, as we do that for 1 year, 2 years, three, what, I don't know, whatever the right number of years are, then, we can make a determination. Well, if we haven't seen a patient in X number of years, then, maybe we can not, destroy that dossier, or, so those are some things that we've thought about.
Yep. That makes sense.
You told me a story once, and it was about training and how staff are trained to use the system. And I think you were actually there. I think you were in Kenya, where you had, it was like several thousand people coming, and you had like a huge staff of volunteers and staff, local staff. And can you kind of share that?
Sure. Yeah, we have done a couple of different training methods, but for that one, we did go on site. So we went to Lunga Lunga in Kenya, and they saw 1,000 patients in 2 days. So it was really big. They had usually between probably 8 to 12 providers going at one time. And so the actual staff was massive, and volunteers, they were just massive. So there was the Red Cross was there, the Kenyan Red Cross was there doing a lot of vitals and, glucose testing. And so, they were involved, and then we had multiple others. So I think we probably had between 30 to 40 each day. And so what we did was we held a training session the day before this 2-day clinic, and it was for, a couple of hours. We actually, I don't know if any of you have been to Africa, but Africa time is a little bit lax. So we got started around a half an hour late, 45 minutes late. We probably had and then we took a coffee break in between. So I'd say we did about an hour's worth of training. So we were able to give them like a 20-minute presentation, just kind of walk through how to use the system. And then we had all the iPads set up. So each group went to their respective tables. So if you were registration, you went to a table with a few iPads. If you were vitals, you went to that table. So everyone played around with it, and were able to enter in patients and play around with how they would actually fill that in. And we could go around and answer questions as they went. And then they were ready. So the team then went the next day, and there were probably each day between 10 and 15 new people who weren't at the training. So we gave them a quick 15-minute, this is how this works. And they got started, and they were fine. So it's pretty easy to use, especially if you can get your hands on it and have people answering questions for you. It's just so simplified.
And the iPad is in English, but you can also push a button and it flips to French, correct?
So you can change your iPad. So if you change your entire iPad to French or a different region, it will apply those regional settings. And so it does French or Spanish, actually any language that Apple supports, our app will switch that language.
Okay. So here's a question that just came in. Lori, how many of EMR clients are using the system for inventory management? Also, how many are compiling client data for use in proof statements on organization effectiveness in delivering healthcare?
Yeah, so right now we don't offer full inventory management, but that is something we're going to do this year. So inventory management is super high on our list. So we've already got some leads on how we'll take care of that. We do allow you to do a formulary, so you could put in your own formulary, and we do track the medications. So you can run reports and still understand your inventory. It just doesn't, remove them. So as you are using it, it doesn't remove them from the inventory. So that's what we're going to implement later this year. But as far as other clients go and how they use the data, we have a lot that are starting to use it more for effectiveness. So we have, there's a group in South Sudan who have a whole list of different sort of metrics that they want to gather so that they can not only see just what did we do, but how are we improving and what can we do to improve as well? And so there's a lot of that that's starting to happen as well. So as we start getting more and more requests for different data fields that can help show that, we can add those in. So that's one thing. So we do have multiple groups looking at that along with research groups. So I think we have 3 or 4 universities who are using us for research as well. And so part of that research goes into effectiveness as well. So we do have a few groups doing that. And then for our next phase, we're looking at an impact calculator. So when you talk about effectiveness too, a lot of that is what impact are you having on the community where you are. And so we are looking at, we've got an impact measurement report that we did for BackpackEMR and how we can impact in general, but we want to do one that you could plug in your numbers for each organization. You know, how many patients did you see, the different gender breakdowns, different age breakdowns, and then how does that actually impact the community where you are? And so we're working on that as well. So that we're hoping to get later this year as well. And some of that could be partnered with surveys. So we have 3 or 4 groups now who we've implemented Survey CTO for. And so Survey CTO is essentially like a Survey Monkey or something, but it allows you to run these offline. So they download them onto their iPads and they can run through population surveys. And then they can input that partnered with the EMR data to really better understand the impact they're having on that community. So what was it like before they came in and what's it like a year later or 6 months later? So as you track over time.
Wow, that's a lot.
But we're getting there. Yeah, we're getting there. I mean, data, once you have the data, right, there's so much you can do.
So, so Diane has a question, and I just missed the so what her question, and I'm going to add one of my own. What technical support do you offer, especially if when we're using this offline? So she's saying it very nicely, a little bit more bluntly. If this thing is going to mess up or break, what's gonna happen? Yeah.
So everybody has both my WhatsApp number and Brenda's WhatsApp number. So you'll get a hold of one of the 2 of us for sure. I monitor it. It's on my laptop. It's on my phone. I've got it. It'll ping me wherever I am. So we're pretty good about answering, especially when we know you're using the system. So we'll be watching. So that's one thing. Technical support, we're on it 24/7. And then as far as being offline, so if you don't have capability to get a hold of us, and you're using this offline, if you don't have, a way to call us or get a hold of us, in most cases, I'm trying to think, we've only had one case so far where something happened while it was offline. Otherwise, the offline system, it's such a mature product offline that it just runs. The one thing that sometimes could be hiccup is the connectivity. So if there's a little hiccup, you're too far from the router or something happens that way, those are pretty easy though to train on what to do to kind of get connected. Otherwise, if anything's going on with connectivity on the iPad, it's a simple close it and reopen it, and it just shakes it loose. It's like a reboot, when you call IT and they're like, well, did you restart it?
Yeah.
That pretty much fixes everything. But yeah, so we haven't had really many problems offline. But yeah, we're always available. And a lot of the questions that we get are user questions, especially on the administrative side. So you don't have to do a lot in administrative, in the administrative tool. So when you do have to go in there, it's like, oh yeah, how do I do that again? So those are a lot of the questions we get. Otherwise, yeah, we're available regardless.
Awesome. You are starting, you're also working with some countries, doing some larger projects with countries. Can you just kind of share that a little bit?
Yeah, we are working on a partnership right now in Rwanda. So I'm pretty excited about that one. It's with a medical supplies company, and this is where a lot of that inventory management will come into play. So that is another driver. So it always helps the more people who are requesting it and need a feature, that bumps it up in priority. So inventory management has always been high, but it's extra high now if we're partnering here with this medical supplies company. They've got about 500 customers across Rwanda. And so Brenda and I actually just visited there last month. It was a pretty cool thing to travel again after 2 years of not traveling.
Yeah.
So that was fun. We visited some clinics there as well. And what we found was for several of the clinics, especially some of the bigger ones, they did want some more clinic management tools. And so I think that's something that will help with other permanent clinics like yours and some others in Haiti. We've got some in Kenya and Uganda as well that I think could use them. So we're looking at inventory management for sure. And then simple billing. And when I say simple, I really mean simple. We're not going to do this massive billing. Like when you think of billing, it's this juggernaut here in the US, but how much do you owe? Well, in inventory management, we'll have what services and then how much are you charging for it? And so when you go and click in a service, we'll pop in those charges and we'll give you the option to pay ahead of time as well. So if you pay early or if you pay after the service, after you get your medication, we'll have all of that in there, but it'll be very straightforward. So simple billing, we'll add in some appointment scheduling. So really simplistic, but a little bit more on the clinic management side. So yeah, we're pretty excited about that too. So Rwanda is going to help drive some of those features.
Yeah, it's demand will drive development of the system and make it better.
Yes.
Yeah.
Yes, absolutely. And
So
so many groups, I think just like your group too, is realizing that a lot of the impact that you can have is around more of the permanent clinics locally run. And so that's where we're seeing a lot of that, more of that demand as well. So we want to not move away from the medical outreach and mobile clinics, but just further empower those local clinics with more tools. So that's sort of the way we're moving, just kind of as the industry's moving as well.
Okay, awesome. Question from Brian. So what is EMR? What is actually, before we get to Brian's question, can you talk? I should have done this when we started, but I didn't. BackpackEMR is a brand name, but BinaryBridge is the name of your company.
Yes, exactly.
Yes.
That's right.
And BackpackEMR, true or false, BackpackEMR is the only product that you have right now?
Yes, that is correct. Yep.
Okay. Will that always be the case?
I don't know. So when I started this back in 2016, that's why I named it BinaryBridge. And I thought we'd maybe have other products. We might do BackpackEMR, but maybe we would do some other tools. So far, the EMR has taken up all of our time and energy. So I don't know how we would ever have another product. So I think BackpackEMR is probably it. But that's why the two different names.
Gotcha. Okay. Well, and that just goes right into Brian's question, which is what is BinaryBridge's business goals the next few years, and what are your sources of capital going to be for growth?
Yeah. So that's a great question. So the way I would see it for the next 5 years or so is we are trying to grow into clinic management a little bit more so. So we'll start building out more of those tools for our permanent clinics, but we'll also add in more specialties. So just like we talked about, some of the add-on features, appointment scheduling, billing, inventory management, we'll add in things like we talked about pediatrics. We'll also add in mother and baby, some of those sort of different modules that are specialized. We had some requests for internal or inpatient hospitalization as well. So we'll add some for if you've got people in overnight. So a little bit more around that to have a more well-rounded product. And then we've also looked at some more partnerships. So we've obviously, like I said, looked at the VBAG is the medical supplies company in Rwanda. They're Rwandan based. And then there are other companies that we want to kind of snap on. So Healy Health is one that we've been looking at for telemedicine. So we already do some of the virtual care, but for some people who do have access to the internet, they want to do some telehealth visits. So they want to do some face-to-face. So we could snap that in. And then we're also looking at partnering with Andaman 7. So they are a personal healthcare record. And so that way, if a group comes to see you in Haiti, and then they need to take their record to a specialist, if you need to send them to the oncologist or to some other group, they can have it on their phone and show that to them. And so you don't have to try to like send the record. You don't have to try to do a paper form. It can be on their phone. And so we're trying to do a few more integrations like that. So as far as like that 5-year plan, we want to build up more of those features for clinic management, build on some partnerships, some of these other snap-on features. And then we want to just continue to grow in that aspect. So that's from our growth standpoint. And then from a capitalization, so we do obviously from a customer standpoint have subscription model, but we are looking for investment right now. We're working on a capital raise so that we can actually do all these product features that we want to do for Rwanda and for clinic management. And so that's where we're doing right now is a little more investment. We're working on that. Our partner VBEG might also kick in some money for like inventory management. So we could maybe do that together, or they might actually build it and then we'll just snap that in. So we're looking at some of those kind of ways to lessen the capital that we need to raise. But so
well, and that's a good thing, because the more healthy you are as an organization, the longer you're here to support us and continue to give us all these great modules. So that's important to us as well. Is there any, I know in Haiti, it's the case, and certainly in most of the African countries as well, almost everybody, not 100%, but a high percentage of our patients have a cell phone, or they have access to a cell phone. Now they may not always have minutes on it, but they have it, and they can find a Wi-Fi, et cetera, et cetera. Is there any of potential use to be able to interact with patients through using this and the phone system?
Yep, absolutely. So we were talking about appointment scheduling, and we are looking at a few different options to snap that in rather than build it ourselves. And every one of those has that capability in it. So SMS, some already are connected to WhatsApp. And so a lot of those are already integrated. So you could do the two-way communication. And then even for the work that Andaman 7 is doing, theirs is Bluetooth. So you can Bluetooth the record to them and they can keep it offline as well. So that's just kind of an extra perk because it actually works in the areas where we're working. So which is nice. So you could do that offline. And then from an appointment scheduling standpoint, you could communicate SMS or WhatsApp.
Yeah. Okay. Awesome. This question actually is for Boye. Boye, can we unmute him, Christina, or does he have to do that?
Go ahead.
There he is. So the question's for you, and you received your BackpackEMR training actually from Brenda when we were in Louisville last year. And so Katie wants to know what your impression of it is, and how you think it'll well, actually said, what do you think of it, and have you played with the system yet?
Okay, I received the training. It's been probably several months, and I will have to transfer that to the providers, which I think Dr. Fresnel get used to it. He's working for another organization using a similar system like this. I think the most important thing I think I need to do right now is having a Zoom again with Brenda and everybody else with me on the same, on the Zoom. And then Brenda will give them like the go ahead and then give them the training at the same time. And after that, I will use it with them so that way they will use it easy. I think it's not something like it's hard to use. I think it's something easy. There will be the problem that I think I might have is first of all, it's not the nurses. It's like the person who's gonna type the name like for registration. Like the person just come to the clinic and then we need to go to do the dossier. Like I don't know if that who I'm gonna choose to do this type of thing, because I don't think Max is capable of doing it, or Junior is capable. I think Junior will be able to use it, but my other concern is we don't have dental on our data sheet on that BackpackEMR sheet. So I think we need to create a space for it. So when we have people come for dental, and then the dentist knows who is waiting for him, and then like the same as providers and everybody else. But I don't think doctors and nurses will have any problem to use the BackpackEMR. The only concern is, like I said, is who I'm gonna use for registration. Is it junior or two-person that I'm gonna use? Because, and then there was a question that I see about the dossier. I think most of the people that we have coming to the clinic, most of them are returned. So when the person, when we're gonna start using the BackpackEMR for the clinic, like as the vital care clinic, people come with a return card, have a return rendezvous, have a dossier return. We go to the dossier return, and then we have the dossier, and then we have all the information about the patient, and then we get it in. We don't really need like somebody coming from the States, like a volunteer coming from the state to put them in, because most of them are there, and then we can put them at the same time that we go and find the dossier inside the dossier building, and then we have all the information about the patient. At the same time, we put everything in that shot for the patient.
All right. Awesome.
Yeah.
So
thank you for the reminder about dental. I just made a note of that too, because I know we've got multiple groups that want dental, so I'll push that one back up too.
And we do need it, because we're gonna start it, let's say Saturday, and then I will have a dentist. So the dentist won't be able to do anything with his tablets, because we don't have a place for him.
Yeah, let's connect, because you could use we have some dentists who use the primary care module, and you can record it in the exam, so we can chat about that. But I will also send you our designs for the dental module, so you can give us feedback, and maybe the dentist that you have can check it out too. So
sure, not a problem at all. So the thing, I think I have Brenda's phone number and WhatsApp, so I will give her a WhatsApp text for this probably over the weekend. So we chat each other, so we'll see what we can do about it.
Awesome, that sounds great.
Mm-hmm. So Diane's asking, what versions of iOS does the system work on?
We've got, I keep one iPad on iOS 12.4. So I know it still runs on 12.4. It will probably still run on older ones. I think if you get much older than 11, it's tough. So that's for the iOS. And then the iPad itself, we typically go as old as version 5s. So those are from 2015, I believe. So you could go as old as that. And we recommend just the regular iPads. You don't need the Pros. They're more expensive, and they take up a lot more battery power too. We have a lot of processing going on. So the regular iPads are usually best. So yeah, as old as 2015 usually, and at least iOS 12.4 and newer.
And it is iPads. At this point, you're not using any other tablets other than iPads, correct?
Exactly. Yep. Yeah. And the next device that we will likely get going, we were contemplating between Android and a web app. And I think we're going to go the web app route, as we're starting to think more about clinics, permanent clinics versus the mobile clinics, because a lot of teams have laptops or desktops, especially for like receptionists or, in the pharmacy. And so the web app itself, we already have a web portal, so that uses the internet. You can use that on any device, but you need the internet for that. But if we want to run it offline, I think we can do one offline that runs on your laptop. And so that's, I think, the next device will enable. So if you've got extra laptops, right, you could use those in the field as well.
Okay. We haven't talked a lot about how organizations are using we have a clinic day. Boye and Dr. Nelson and our Haitian staff do just a beautiful job of running it like they always do. Everything goes really smoothly. It's the end of the day, and the Boye goes up to his office and the internet is working flawlessly, and he pushes the button and up the data from the day goes up into the cloud. And then what can, obviously, we're not going to have every volunteer in our database have access to it, but whoever has access to it, what can they do once BOE sends that information up?
Yeah, so once the data is in the server, there's a few things that you can do now. So you can use the web portal and go online and see all the patients. So you could have someone in the United States if you have maybe a dermatology question. So now you could have someone in the United States log on and look at that patient. So you could put them in like a virtual care queue and they could take a look there and give feedback. So that's one thing you can do once they're uploaded. The other thing is the data. So now we are working on this data reporting dashboard. So I don't know if everybody could hear me. I was kind of dancing around here. I joked around
No,
with
we got
Brenda.
We got you.
I was talking about how I have all this power now because I have access to the SQL database with all of our reporting data. So that's new, but we also have a front end dashboard to that. And so it will be embedded in the web portal as well. So that I'm hoping by next week or the week after. So within the next couple of weeks, you'll have access to that data as well. And so you'll have one or two administrators who will have access to that and you can just log into it and it'll have a dashboard of how many patients you saw. It'll show a little chart of per day, how many patients you've had. So you can see when you've got high days and low days. You can sort of start doing some of those trending analysis. You'll also be able to export the data. So if you want to play around with it more, and then we're always happy to export even more data if you want nitty-gritty details.
So will like our providers, will they be able to look at individual charts, individual dossiers?
Yep.
So they can do a dossier review?
Exactly. Yep.
Okay.
Okay, can I have a question?
Yeah.
Okay, more than likely, our internet system is working like full time, except if there's a problem, but more than likely 7 days a week. So our internet system is working. So what do you think if we just leave the server on the Wi-Fi all day? So we get it connected for most of the day or every day. And then I don't have to on the afternoon to go and load it up. It's like uploaded by itself since the internet is working. What do you think about that?
Yeah, you can definitely do it. I think this is where you can experiment and you can try that for a while and see what the speeds are. One thing that happens when you connect it to the internet, our system does two things. So not only is it uploading data to the internet as you're typing it, it'll upload it as well, but it will also peer it. So it's looking for its peers. We call them other devices that are connected. So it'll do both. So if all of a sudden the internet goes out, you're still running just fine because everybody's still talking to each other. So it'll do both.
It's like my question is, if we have, let's say, seven iPad on the system, all work together, like the providers and nurses and my office and crowd control, all of them are together and then all connect to the internet. Is there a problem with that? There's no problem.
There shouldn't be a problem. It just depends on how strong the internet is. And if it's, if you're finding that it's not as strong or if it's slowing down the system because it's, peering and sending up at the same time, then you could just run it offline. In order to upload the data, and I'm not exaggerating, the data itself uploads in seconds. So it really is just connecting an iPad to the internet and opening the BackpackEMR app and just letting it sit for 5 minutes and it'll upload all the data. The photos take maybe just a few more minutes, maybe 10 minutes, leave it open, just make sure all the photos go up. But that's about how much time it is. So it's pretty quick. So you could try it both ways and just see how it works.
Okay, another question. Is it necessary to take a picture of the patient or?
Nope. Nope, it's optional. Yeah, you don't need to take one. There are photos in the profile, so you can take a picture of their face or like an ID card. So I know you've got some cards, you could take a photo of those. You could also take a photo of a lab result or in the exam. So you have a few places you could take them, but you don't have to take any photos.
All right.
So we're coming up on an hour here, and on the last few minutes, there's been some developments going on in Haiti recently, and I'm going to have Boye just kind of share what's happening on the ground. And so we're going to do that probably in about 6-7 minutes. So any last questions, especially from the medical folks? Any hardcore EMR questions that I know Lori will be able to answer like that. But any questions from our medical staff on specifics of how the EMR system works?
And
Okay,
Nathan, we can just say, you can unmute yourself if you're in the medical field and want to ask a question. Yeah.
I did. Diane just texted when I think she texted it before I said people could talk, but her questions is basically around legal. And, we know that Haiti doesn't actually have a HIPAA type thing, but as an organization who is, part of our values is to treat our Haitian patients as we would treat ourselves. So what is our, I guess, how do you, for data breaches and all of that, how do you respond to that as a question?
Yeah, it's a great question. We're also very concerned about it. I've been to a lot of global or digital global health conferences, and data breaches are something they talk a lot about. Data security, data privacy. It's something that has not been top of mind for a lot of these digital health projects. And especially when it's, a lot of these NGOs that are bigger have just sort of seen the need, and they'll create something quickly and as cheaply as possible and deploy it. And it's not very secure, and they're not thinking about a lot of those things. And so before we even got going, and if you remember, I was part of Target after that guest data breach. So it was also top of mind for me anyway, but we added a lot of security in there. So we collaborated with a cybersecurity team called Protocol 46. That is here. And so we had them do penetration testing and a security audit for us a few years after we got up and running, just to do a check for us. We're engaging with them again to do another one now that we released the web portal, just to make sure that that's secure. We've also added in quite a few security measures for the offline piece. So when Target had their data breach, it was called a pineapple, or a man in the middle, which means someone interrupted that flow of data as it was VPNing into Target's system. And so we have encrypted our data as it flows. So not only while it's offline, but also as it's going up to the cloud. So we do a lot of data security there. That's also the reason we went with iPads. So Apple is very secure. They encrypt their database already, and they've got multiple tiers for authentication. And so that's another reason we went Apple, was security reasons. And then we do have a lot of extra security at AWS, which is where the central database is. So from a data security standpoint, I feel like we're doing pretty good there. And then from a privacy perspective, a lot of the patient privacy pieces are kind of up to the organization, the process flow wise. And so some of that is making sure you have good process. So not sharing your logins, those kind of things. Also, we've got a consent button right now. So we encourage people to have their own consent forms that either people sign, have the patient sign it, or if you need to read them, the agreement, and get a verbal, confirmation, then you can click you have the consent. So a lot of those pieces will go a long way. And we do have sample consent forms too, if you needed to start with something and just kind of modify it. So those are a few pieces that we're doing. Every country is a little bit different, but they all are very, very clear on privacy and security. So those are the two pieces that we're striving for too.
Awesome.
Thank you. Thank you.
Sure.
So, all right. Well, and of course,
I see Dr. Lucas is unmuted. Does he have a question for us?
The comment, question, whatever, is this is going to take a while to implement. And as a provider, we're going to have to maintain our dossiers probably for at least a couple of years before we can abandon that. Because many of the decisions that are made are based upon prior visits and prior data. And it's going to take a while to get all that up to date as time goes on. So I would just be careful not to abandon our paper records too quickly.
Yeah.
Yep, it's definitely a good point. I think that's part of the reason why some teams have chosen to do some data entry. And again, you just like you were talking about before, process wise, you could pick and choose which ones you do enter, and maybe you don't enter them unless you see those patients. But yeah, it's a good point.
Yeah,
the past history is very important.
So, all right. Well, thank you, Lori, and thank you, Brenda. Brenda, you didn't get a chance to say very much, but you were active on the chat, so that was good. Appreciated that.
I'm Lori's backup. Yep.
Yeah.
Oh, good.
And so anyway, so thank you for being with us, and we're excited to be putting your product into use, and hopefully will be another wonderful case story that you could tell, your next client or your next client that, we're working at this group out of Jacmel and they're just doing fabulous and all the great things. So
absolutely. Well, thank you for having us and letting us kind of tell more about BackpackEMR. You're doing amazing things and we're excited to be partnered with you. So thank you.
And my last thing is thank you for all of you for being on with us, being on the call tonight. We called this the Insider series because it is our insiders. It's our closest FOTCOH family. And, I know that you haven't been to Haiti. Our last team down there was October of 19. And I know a lot of you are aching to go back and see friends and to engage again in what we do there. And someday we will get you back. But in the meantime, being on this call, learning about what we're doing, sharing the story, like Christina said, that is a way to be part of what we're doing. And your financial gifts make a huge impact. We can't do this without you. So anyway, thank you for being on the call, and look forward to our next one. We know what our topic's going to be, but we don't have a date yet. So I'll leave you in suspense for that, of when our next Insider series will be, but it'll be in the next couple months. So anyway, that's all I've got, and good night. Thanks for being with us, everybody.
Thanks, everybody.
Stay safe, Foyer.
Thank you. Nice seeing you.
Good seeing you.
Thank you.